How would you feel if all of your social media was hijacked, so you had absolutely no control over what you posted, when you posted, or who saw it? It could be anything from swearing and profanity to insults to close friends and family members, or just strings of nonsensical words. Pretty scary, right? Now imagine if this happened to your most basic forms of communicating with others. An estimated 300,000 adults and children suffer from a form of Tourette's syndrome or tic disorder in the UK alone. That's enough to fill Wembley Stadium 3.3 times. Tourette's syndrome is a neurological disorder which is a combination of vocal tics, which are the involuntary and spontaneous uttering of noises or words, and motor tics, which are involuntary movements or muscle spasms that can affect any part of the body at random. Most people automatically associate Tourette's syndrome with obscenity, but it's by no means limited to swearing. When a Tourette's syndrome sufferer does swear, it's known as coprolalia. Despite being widely covered in the media, swearing or coprolalia actually only occurs in less than 15% of Tourette's syndrome sufferers worldwide. Vocal and motor tics can be classified into two groups, simple and complex. Grunting, barking, hissing, sniffing, snorting and throat clearing are simple vocal tics. Simple motor tics are quick eye blinks or jerks, lip-licking, head twitches, shoulder shrugs and muscle tensing. Complex vocal tics are more complex sounds such as words, phrases or whole sentences. Complex motor tics can either be a string of simple motor tics or movements involving more than one muscle group. This might get complicated. Tourette's tics can be expressed in different ways. Copropraxia is the involuntary making of obscene gestures. Coprolalia, the involuntary uttering of obscenities or swear words. Coprophenomena, a combination of obscene gestures and swearing. Echophenomena is the repetition of other people's words or phrases. And polyphenomena involves the sufferer repeating his or her own words rather than the words of others. NOSI, or non-obscene socially inappropriate behaviour, involves making gestures or saying things that are not obscene or swearing but are still not socially acceptable things to say. Relax, that's the complicated bit over. So what actually causes Tourette's syndrome? The truth is, no one actually knows for sure what causes Tourette's. Scientists currently think that an area deep inside the brain, called the basal ganglia, that helps control movement may be to blame. Something wrong with this particular area of the brain could cause the sufferer to be compelled to make random movements or noises against their will. But Tourette's syndrome is often related to other behavioural disorders, such as OCD, which stands for Obsessive Compulsive Disorder, and ADHD, which stands for Attention Deficit Hyperactivity Disorder. These are two of the most common, but Tourette's syndrome can be related to a range of different conditions. So what's having Tourette's actually like? The sufferers have little or no control over what their tics make them say or do, when they happen, or how often they happen. As hard as it may be to believe, what Tourette's syndrome sufferers say or do as a result of their tics is often nothing to do with what they are actually thinking of. It can be described quite like a sneeze. You can feel it coming and sometimes hold it off, but it gets pretty uncomfortable. But in the end it always comes out, and the only way to get relief from the feeling is to sneeze, or to tic. So you'd think it'd be pretty easy to spot someone with Tourette's. Well, unfortunately it's not always that simple. Some Tourette's syndrome sufferers can go for hours or even days without feeling the need to tic, but on other days may be ticking several times each minute. In fact, some Tourette's syndrome sufferers have enough control over their tics to go unnoticed for long periods of time, even when you might share a lecture with them.